Tom, welcome. I want to start with the CDC guidelines. They're out finally. Are these kind of clear instructions what we should have been getting from the government all along?
It's helpful. It's unfortunate that they were delayed because of the process in Washington. And the CDC website remains the best place to go for advice and information on coronavirus. It's had more than 1.2 billion clicks. So Americans still, with reason, trust CDC. I wish we would hear from them more often and more regularly. But what they do put out is important. It gives a careful way of thinking about things. Frankly, there is a difference between what they put out and what was leaked earlier, in that the leaked version had some criteria for how much virus is spreading in the community. And Stephanie, I think really we have to come to a middle ground here. There are some who might say, pay attention only to public health issues. There are others who may say, listen, let's just restart our economy. And I think if we do either of those things, we're not going to get the balance right. We have to get the balance right. That means we have to double down on our public health actions. We have to find cases, isolate them, trace contacts, quarantine. This virus is not going away. And if we just ignore it, it will come roaring back. It will kill our seniors. It will kill vulnerable people. And people won't be willing to go back into the environment. On the other hand, we have to recognize that people are so eager to get back out. We're tired, but the virus isn't tired. So when we come back out, we need to do it carefully. Hand sanitizer, face masks, physical distancing, stay home if you're sick. And if you have an underlying condition or you're older, you really want to stay separate from other people as long as possible and minimize your contacts with others.
Doing this responsibly and regionally is important because this virus has hit different parts of the country in different ways. We obviously populate in different ways. So I want to look at how some of the states are reopening because they're in very different places in terms of the virus. The chart we're showing here shows New York and Louisiana. You can see the curve peak and then it goes down. But now you look at Arizona and Oregon. Those are two states that are already reopening and the line goes straight up. In fact, 37 states have charts like that one. What does it tell you?
There is a rush to reopen. And on the one hand, going outside is good. There's very, very little risk if people are outside in the sun. There's very little risk if you're going to a workplace and you're the only one there. So we do have things that can restart, but we have to restart without rekindling. What we've seen all over the world are big explosions of cases if people aren't careful when they come out again. And because people are interconnected, what we've seen is when people have a lot of disease in one part of a state or country and rush to another, that may rekindle the outbreak there as well. So the key here is balance, understanding that we have to accept the virus is here for at least some time to stay. And we're going to have to be really careful when we go out. But that doesn't mean we have to stop all of our activities. We can get back to the new norm.
But are people going to do that? Because you wrote an op-ed in the Washington Post all about this, accepting that this pandemic has changed our lives for the foreseeable future, and we have to get a new normal. But I want to show you video out of bars in the state of Wisconsin. This is 2 days ago. All these people right there are rocking it just like they were, living the same lives they did back in January.
I think if people ignore this virus, they ignore it at their peril and at the peril of the people they come in contact with. Their parents, relatives, kids, people with underlying health conditions, the healthcare workers who are going to have to care for them if they become ill. So if we don't take this virus seriously, it's going to come back to bite us.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.